I was recently part of a press conference, and I was amazed by the very fine distinction between patients at hospitals being hospitalized due to COVID, with COVID, versus being at the hospital due to COVID. That very fine distinction, with COVID or due to COVID. Could you explain that a little bit more for the audience, please?
Well, from the beginning, we pay most attention to how many people in the hospital, because we know that when we look at the number of cases, to be a case, you have to be tested, and not everybody's being tested. So there's a certain inaccuracy in looking at the cases alone. But to be hospitalized, we've always thought, well, if you're hospitalized with COVID, then you're sick and you needed to be. So that's probably an accurate measurement of what's happening. Today, however, it's changed a bit because, again, Omicron is very common and many people are not very ill from Omicron. So if next Tuesday I'm scheduled to get surgery for a lump in the breast, or I have a gallbladder that needs to come out, I go to the hospital on that Tuesday morning for my scheduled procedure, and I'm tested for COVID. And surprise, surprise, I have COVID. I didn't have any symptoms, but because Omicron is so common, people are turning up and being found out to have COVID at the time that they're being admitted for a procedure. Or maybe it's a serious thing. Maybe they have a serious injury and they're admitted, and they also found to have COVID. So COVID is more common, and you can be hospitalized with COVID, or you can be hospitalized because of COVID. So some person comes in and they're coughing and they have fevers and their lungs aren't working and it's COVID, and you're like, you're hospitalized due to your COVID. And then there's this other group of people who are hospitalized for another reason, but it turns out they have COVID, so they're hospitalized with COVID. And when you combine those two numbers together, that's the total number of people who are hospitalized and have COVID at the same time. And we have estimates that maybe 4 of every 10 people who are hospitalized and have COVID are actually not sick from their COVID. So 4 of 10 are not sick. They're just hospitalized with it. And that impacts the way we look at our overall numbers, because it means all these people in the hospital with COVID, not all of them are there because they're sick from COVID. And so I have to moderate how I look at how things are going with the pandemic because of that issue that we have today. Something we didn't see 6 months ago with the earlier versions, but now is something we have to take into consideration when we look at the hospitalization rates with COVID.